Hey there, I'm Dr. Paul Looney. I'm a board certified psychiatrist, and I have a love hate relationship with psych meds. This video is about the use and abuse of psychiatric medications. This type of content is valuable for you. Please like, comment, and subscribe. So, psychiatric medicines play a vital role in treating mental health disorders, but they also carry risks of misuse and abuse. So, let's explore this important topic. When used as prescribed, these medicines can significantly improve symptoms and the quality of life for many patients who suffer. Medication can be the difference between a healthy, satisfying life and crippling disability. In some cases, the proper use of medicine is even life saving. So, in their proper use, psychiatric meds work by altering brain chemistry to help regulate mood, thoughts, and behavior. But they are most effective when combined with lifestyle changes, psychotherapy, and other treatments. When prescribed after a time of severe crisis or high anxiety or depressed mood, they can act like a splint on an ankle after it is injured. Imagine how the tendons and ligaments are stretched or torn and need support in order to heal. At one time, I was a university campus doctor and had an athlete who resisted wearing a splint because she wanted to run unencumbered. That's my goal, I assured her, but without the splint, the injury could get worse and the bones not be properly aligned as the joint recovers. So, in psychiatric cases, this medication splint, if you will, can bring the brain chemistry back into alignment to allow for healing. The medicine can allow the formation of healthy brain and body habits, and in many cases, the splint can be removed after a time of healing and growth. Often, medicine can give the person the calm and the energy to address issues that otherwise might be overwhelming or impossible to address, especially when there are old thought patterns that are negative or limiting, especially those that have become coping strategies and formed in childhood. The medicine can actually promote new brain cell formation and allow new and healthier neural pathways to be established. The saying when it comes to brain chemistry is that the neurons or the nerve cells that fire together wire together. And if you can promote new ways of thinking in the brain, then those new pathways can get established and grow over time. Whereas when a person is stuck in the rut of depression or anxiety, their brain has very little capacity to move out of those ruts to form new pathways. The medicine can help to get the brain out of the rut, so to speak, and onto a better path. Now, if a woman, say, comes to me because she's feeling trapped in a miserable or terrible marriage, medication can help restore her mind to a calmer, happier place and can give her the clarity and the courage to address the problems she's facing. She can then take action to promote change. In this case, she's using medication to help her engage life fully and responsibly, and thus properly using the medication. If she can address both current and past issues with the help of a pastor, a counselor, or a life coach, then they can help her figure out how to move forward and decide on the best course of action to move into a better future. However, some people want to take medication to avoid dealing with real life problems, and they're unwilling to make those behavioral and lifestyle changes that benefit our thinking and our overall health. They simply want relief, which medication can potentially offer them, but that may only be in the short run. In my view, turning to psych meds in this way is really a form of abusing them. In the Garden of Eden, Adam and Eve used the trees of the garden, which were good and were made for their benefit, to hide out from God. In the same way, we can use otherwise good medicines to avoid healthy relationship with ourselves, with our circumstances, with God, and others. As is so clear with the abuse of alcohol and other drugs, if we turn to psych meds simply for relief of psychological pain, that's problematic. When this happens, then the psychiatric medicines can cause other difficulties with side effects or dependency if we see them as an end in themselves. In the case of the woman with a bad marriage, unaddressed, her life problems are likely to eventually cause a failure of the medication, and she'll be back to anxious, depressed life again. Thankfully, though, when this happens, the failure of medication can be a gift from God. When He is inviting us to drill deeper, to address unresolved issues from the past or in the present, to connect with our deep convictions and our strength. Sometimes we need a crisis to make us desperate, to force us to wrestle with God in our situation in order to find a new way, to grow and to transform in a way that makes us more compassionate, more resilient, more courageous, and more confident as we navigate the challenges of life. So for while many, medicine is a short-term necessity, and often it can be diminished and set aside after a time, but there are some conditions that will likely need at least a maintenance dose of medication for the lifetime. These include things like bipolar disorder, schizophrenia, recurring major depression, obsessive compulsive disorder, and some other severe anxiety disorders will often do better with maintenance medication. But these doses often are much lower than the doses initially used to treat. The old saying is an ounce of prevention is worth a pound of cure. And so some people who struggle with depression, for instance, if they start a very tiny dose of a medicine like Prozac, maybe one pill a week, it keeps that medication on board and prevents the recurrence of depression. That's a big win for those whose brains have been repeatedly caught in the grip of a deep depression. But like other chronic illnesses, chronic mental illnesses need to be treated holistically. Like diabetes, high blood pressure, or elevated cholesterol, the best outcomes often require medication plus significant lifestyle changes in our diet, our level of activity, our ability to be responsible and respectful in regard to work and relationships and to family. These changes are what ultimately will make us healthy. I have a handout that I give pretty much everyone I see. It's called Bless Your Body, Bless Your Brain, and it deals with a number of different strategies to help treat and prevent mental illness, as well as living the full life that God wants for us. If you want more on that, there's another YouTube video, or several of them, about that handout. I believe you can get a copy of it on my helpforyou.us website as well. So healthy life choices, as we get help with medicine, can help decrease the need for those medicines themselves. And exercise in particular is a huge factor in supporting, maintaining mental health. So get moving. Once again, though, medicine can provide temporary relief to facilitate changes that need to occur. It can be like a little assist, a grace in a pill, if you will, like a temporary grace period to help provide the calm and the courage to act on the knowledge that we need to change our ways. That said, if you take the medicine and it gives you that little boost, if you don't ride that wave and use that energy boost to get moving and exercise, for instance, it will likely not last. And if you don't use that assist, that help to get moving, then once again, you're going to find yourself immobilized, slipping back into the lethargy of depression or the paralyzed overwhelm of anxiety. Don't let this happen to you. The medicine is not your solution. It can only assist you in taking responsibility for your life, for your mood, your happiness, your productivity, and your relationships. This is your life. Medication can give you a leg up, but you have to ride the horse. Now, this little video does not address the more glaring instances of medication abuse. If you want that, please indicate it in the comments below. I hope you find this little video helpful, And if you have other issues you want me to address, please let me know. Please like, comment, and subscribe. I love you. Bye.